Well, let's just see if there's anything else we really need to talk about. So for the 90-day restoration, we're going to have expert guidance. There's going to be daily support, mindful practices, some good nutritional tools. We're creating a big community so we can have community connection, educational resources, some good giveaways, amazing giveaways even. And then we're really excited to see the results, which we're going to get guaranteed results. Like this is going to absolutely make a difference. Um, these are the tools for month one. We got a um, we got a VMG Plus, the E Omega Plus, the PB Restore, MetaPower Moto 2 Max, Revitazen Advanced Organ Detoxification Complex. When you buy that in the kit, you're going to get the Serenity for free as well. Okay, and we're going to have a kickoff on Thursday, October 23rd, starting at 8 p.m. And with that, I think let's shift and we're going to go do some questions, okay? So let me pull up the questions because these are some good questions, guys. So first question, I'm wondering how many of you think the same thing. Why castor oil? What can it do? And why should I pick doTERRA's version of castor oil? Okay, so castor oil, whichever one you want to say, it's coming from the Ricinus communis plant. And what's unique about it is it's rich in ricinoleic acid. It's an omega-9 fatty acid. And for those of you who already had a chance to get your hands on castor oil, especially doTERRA's, you're going to appreciate that it is rich. Okay, it's strong, it's moisturizing, it's soothing. So it's going to be really good for the skin, but it also has a lot of anti-inflammatory properties. And that's one of the things which we're really going to use it for. Okay, so it's going to be great for deep skin hydration, sealing in moisture. It's going to be great for soothing stiff muscles, joint aches, like wherever the joint is, inflammation. It's going to help with soft tissue issues. It's going to help to improve circulation, and that includes improving lymphatic flow. Okay, so that's why castor oil. So why doTERRA? All right, because we know that quality matters. All right, and what I love about doTERRA is like purity is their pursuit. Like they're constantly pursuing purity. How can we get the purest whatever we can? Okay, so in this case, how can we get the purest castor oil? And so it's organic, it's cold pressed, it's hexane free, it undergoes the certified pure tested grade standards that any of their essential oils goes to assure its purity and potency. So that's why doTERRA, when we compare that to other commercial castor oil brands, we're looking at castor oils that are using solvents to aid extraction, so they're improving their yield, but that leads to a lower quality control. Oftentimes there's poor packaging. Okay, the packaging itself can leach into the oil. It can doesn't preserve the oil as well as the amber glass does that doTERRA chooses to pack their castor oil in. And as you get a poor like solvent extraction, low quality, poor packaging, it's going to degrade the effectiveness of the essential oil. And so what I love is doTERRA is going to ensure a higher quality consistency that we get to appreciate. And so in short, it's the doTERRA quality it's going to set it apart. And why is it good? Because it's got the ricinoleic acid in, which has been shown to reduce inflammation, relieve pain when applied topically. Okay, which is awesome. Another question: what do Revitazen Plus and a Revitazen oil do? When do we take them? How do we use them? So that's a great question. So both Revitazen Essential Oil Blend and Revitazen Plus Advanced Organ Detoxification Complex, they're designed to be used together. All right, the Essential Oil Blend is designed, well, they're both designed for daily use to help support organs of detoxification. So primarily we're looking at the liver, the kidneys, and the colon. The oil, the Revitazen essential oil blend, is going to combine tangerine, rosemary, geranium, ginger, juniper berry, and cilantro. All right. And the reason for those is because each one of these has been chosen to help improve detoxification, antioxidants properties, and organ support in that detoxification process. Okay. Revitazen Plus is an the advanced organ detoxification complex. So I think for now we'll just say Revitazen Oil and Revitazen Plus. Okay, so we know it's just a mouthful. I'm sorry, guys. But the Revitazen Plus is going to have that blend of essential oil, which we just talked about, in addition to herbal extracts coming from milk thistle, artichoke leaf, black cumin seed oil, and cumin seed oil. All right. And not just does it have those, but with the milk thistle, it actually has the Silbin phytosome, where it's in a special crystallized form to really improve the absorption and the usability of the herbs. And what that's going to do is it's actually going to help with phase 1 and phase 2 liver enzymes. So that's going to help to identify the toxin, start to metabolize it, and then improve antibiotic, not antibiotic, antioxidant defense. So it's going to help to support the enzymes, the bile flow, kidney filtration. And what's nice about that is it's doing it in a natural way, which isn't going to lead to an uncomfortable purge. I was trying to think of a really good way to demonstrate, like, how is it different? Okay. And there's a I Love Lucy scene where she's packing pies. I don't know if any of you have seen this one, where she's sitting on a conveyor belt and a pie comes down and she gets the pie, put it in a box, closes it up, and puts it. It's easy, nice steady pace. She's able to keep up with it. Okay. And that's how our body wants to be. Okay. When our body is, when the toxin levels are appropriate, our body's able to function appropriately, and we're able to easily deal with toxins that build up in our body. Okay. So as the sketch goes on, the conveyor belt speeds up. And as the conveyor belt speeds up, poor Lucy's just, she's going as fast as she can. It starts to become a mess. Things are backing up. Pies are falling off. And that's what happens in our bodies as toxins build up. And how she's responding is how a lot of traditional detoxification products work. They stimulate the system to try and get it to work quicker. So she's going as quickly as she can. She's overwhelmed. She's making just as much mess on this side as this side. And that's not ideal. It just leads to chaos. It's a funny sketch, but it illustrates the problem perfectly. What I like about doTERRA, instead of stimulating the system, it's providing the system with the nutrients to support the function. So that would be like, instead of stimulating Lucy to work harder, bringing in an extra 1, 2, 3, or 4 people who can all work together. Okay. And as they work, so we're mobilizing the body's resources to work properly and efficiently so that it can keep up with the load. All right. Which I love. Okay. So as we're supporting the phase 1 and phase 2 liver enzymes, it's like we're bringing in extra people to help with the workload. Okay. So how do we use it? With the Revitazen oil, you can use it internally. So you can put a drop in some water and drink that. Okay, very cleansing. You can do it daily. I like to do it in the morning, just kind of get things going, or as needed. You can use it topically, where you can apply it usually over the liver. You can put it over the kidneys too, or over the colon, just to kind of help support those organs as well. You can also put it on the feet. So if you've got a younger child who you're trying to help, maybe they've got some allergies or other issues, this is going to be a great way to help support them. Okay, especially if they can't take the Revitazen Plus capsule. All right. You can also diffuse it aromatically. Just put a couple drops um, in a in a diffuser, and you can diffuse that, and that's gonna um, offer some benefit as well, helping to your organs detoxification as you still inhale those oils. Get this, you're still going to get the chemistry in as it goes through the nose, through the olfactory system, and really start to stimulate different areas. Okay, and then there's with the Revitazine capsules, that's going to be straight internal. Okay, we're going to swallow those capsules. Typically, it's going to be one capsule daily. If you need an intensive cleanse or detox, go up to two. Um, I would separate it, one in the morning, one in the evening. Okay, and then if you're going to be doing two, definitely make sure you're drinking plenty of fluid just to kind of help continue to flush. How long? What's the duration? What I like about the intention here with Revitazine oil and Revitazine capsules is they're designed that you can use them daily for ongoing daily use. So depending on your needs, it can be daily, or it can be used in cleanses or like cycles, like a 30-day cleanse or a 90-day reset. And you can do that, a couple times a year, however, whatever fits your needs. Okay, which I really, really like. And again, because we're mobilizing the body's systems and we're supporting the systems, um we're not overstimulating them. It just makes it a much easier, gentler way to detox, but like very, very powerful and at a cellular level as well. When you compare that to other cleanses, a lot of detoxes rely on harsh laxatives to really kind of purge what's in the intestines, diuretics as well. And that can lead to a lot of unpleasant bowel movements, unpleasant trips to the bathroom. Um, when we're doing Revitazine, it's designed explicitly to be calm. Um, in the notes, there's a question about binders. Okay, so as you all know, I'm an emergency physician. Is there a role in, is there a purpose for binders? Yeah, there are, and I do use binders. But let's just have a serious conversation about when I recommend using them and what their purpose is. Okay, so a binder is going to bind things in the intestines. Um, One of the best binders out there is charcoal. It's such a porous substance, it's going to bind. Now, binders aren't selective, okay, meaning there's no binder out there where it's only going to bind heavy metals or it's only going to bind like viruses or it's only going to bind, XYZ. All right. Binders bind everything. All right. So when do I use binders? All right. Typically, I'm going to use a binder when someone has just had a serious toxic ingestion. All right. So, the classic scenario we see in the emergency department, someone dealing with depression, severe depression, they decide to take a lot of pills, okay, which can be very caustic and damaging to their bodies. Okay, so we want to give them a binder to bind up all of that so that it's not going to get absorbed into their bloodstream. And the binders are going to bind indiscriminately. Okay, it doesn't just bind like the medication that they're taking, it's going to bind all the nutrients and everything that's in their intestines. Okay, it's going to typically stimulate the bowels as well. So we're going to increase the transient time to kind of move things throughout the colon. And so, yeah, like in that instance, like binders can be life-saving because we're preventing the this overdose of medication from harming the body using binders, and that is a great place to use binders. Okay, but the consequence of that is, yeah, it's also binding all the nutrients. Okay, all the good stuff that's in their gut as well is gonna be bound up in the binder and out the way. So um, that's really the only time I recommend using binders when like you've got this potential emergency that you want to prevent absorption in the intestines. Okay. If we're looking at, maybe you ate something that's bad, like I would much rather like use something like Revitazem Plus, DigestZen, maybe GX Assist, because that's going to have a much more positive impact on our system because they're coming from essential oils, which do actually have the ability to biodifferentiate. We know that it's not going to have an effect on the good bacteria in our guts. We know it's not going to affect our nutrient absorption, but it is going to help protect against harmful bacteria and helping to support our intestines as they get over the, whatever the bug is that's causing the food poisoning. Okay, so I hope that makes sense. Do binders have a role? Yes, but I really I really just use them in emergency situations. People who are recommending them for for detox, I think they're misunderstanding like what the purpose of a binder is and how it really does bind everything. Okay. I think it's so much more effective to support the body in doing its job because the body really does have so many mechanisms and systems to actually identify toxins, neutralize them and remove them. Your body's going to do that. If we can support the body, that's going to be the best, healthiest way over time. Okay. Um, and I like that when we do it with doTERRA, like with these natural extracts, instead of impairing our body's ability to absorb nutrients, it's actually going to enhance them as well. So I think that's awesome. Like that's fantastic. All right. Sorry, that's I could go on and on about that. So hopefully that helps. Um, Question 3. All right. I have a catch in my left leg after wearing a boot. A nurse suggested castor oil plus fractionated coconut oil plus mild heat to relieve pain and stiffness. Is pain relief a primary use for castor oil? So yeah, like um because it is anti-inflammatory, pain relief is a great use for castor oil. So how can we use it? All right. So do you have to use fractionated coconut oil? You don't. Okay. So a great thing about the castor oil is because it is so thick, I love adding different essential oils to it. So for you, whoever wrote this question, if you've got some pain in your leg, pick whichever oil you use for pain. Okay, so I guess that's actually a great time to invite you guys. If you've got a pain in your leg, what type of essential oil do you like to use? All right, I'm curious to know, what do you like to use? Because everyone has their own either oil, blend, or selection of oils that they like to use for pain. So I'm curious to know what you guys like to use. But what's nice is if you use, so Nancy likes using Deep Blue. If you were to use Deep Blue with the castor oil is actually going to hold that Deep Blue in, allowing it to penetrate more into the leg. You're going to have less flash off. Okay, so it's going to enhance the effect of the essential oil. All right, here we go. Yeah, so Copaiba, turmeric, and Deep Blue. That is a great combination. Copaiba and marjoram, Copaiba, the Deep Blue stick or frankincense and Copaiba. I like that. Deep Blue Copaiba, lemongrass Copaiba. Yeah, like and again, I love that people have their own, like, this is what I like to use. Like if you don't know what you like to use, like, this is why we're in a community. People have tried different things. Some work better for other people. So try it. Use what you have at home, give it a go. But if you want to enhance the oils, castor oil is going to be really good because it's going to help hold the oils, but it's also going to have anti-inflammatory properties itself. Okay. Why would I use fractionated coconut oil in addition? Just to help spread it out. Okay. Castor oil is pretty thick. And so let's say if I want to do a big area, it might be easier to add a little bit of fractionated coconut oil just to make it easier to spread in that area and to massage it in. You don't have to use fractionated coconut oil. Okay. Adding heat is great because, again, it's going to help to improve that penetration. And one thing which can be really good with castor oil is then to use the wrap. Okay. So a convention doTERRA had that wrap. So let's say it's the knee. Yeah, you'll oil up the knee with, you know, deep blue, copaiba, frankincense, put some castor oil on top of that, and then get the wrap and just kind of wrap it up. So whether it's the knee, the calf, the ankle, wherever it's at, okay? If you then want to put some heat on top of that, that's fantastic, okay? And that's how I would use it. Okay, now I would say if you've got a catch, that could be the result of some scar tissue. It could be, if it's in the knee, it could be a torn meniscus or a ligament. And so, you know, use the gifts of the earth, use what we can from doTERRA. But if it isn't improving, don't hesitate to also see your primary care, because if it's a structural problem, sometimes we do need the surgeon to help fix things. Okay. But what I do like is a lot of times we are able to get good relief using these natural products. And I love that it gives us opportunities. It gives us options. Okay. Which is so needed, I think. Um, and this is another big thing to remember. Okay. Um, once probably isn't going to be enough. All right. As you use it, day over day, consistently, that's when you're going to start to see more and more improvement. Okay. So as we use these things persistently, you know, every day, that's when we're actually going to see the biggest impact. All right. They will help as a once off, but to really get the biggest effect, use them frequently. Okay. And I think that will really help. Um, Okay, how do we detox inside cells? When toxins accumulate on receptors, block hormones like insulin, how do we clear them so signaling works again? And so this is again is another thing which I really like about doTERRA's solution to detoxifying, as opposed to binders. We're not just focusing on the gut. We're able to actually get at the cellular level, helping to improve everything. Okay, so big things which we want to identify. Okay, so the core issue are going to be certain toxins like heavy metals, endocrine disruptors, and persistent organic pollutions can bind to cell receptors and are going to disrupt the signaling pathway. Okay, it can lead to a lot of disruption within the cell. It can lead to insulin resistance and create chronic dysfunction within the cell. So when we want to detox the cell, it's a multi-pronged approach. All right. So first off, when we support phase 1 and 2 liver enzymes, that's going to help the toxins be identified and processed. Okay. So that's going to be really, really important. Okay. And with Revitazem Plus capsule with the milk thistle, artichoke, black cumin, and cumin oil, they're going to enhance those pathways where they're able to release enzymes from the liver, to start identifying these toxins, um, and starting to process them, conjugate them so that they can be removed from the cell, moved into the bloodstream, into the, from the bloodstream, kind of like some will go through the liver and be metabolized and then excreted. Some will go through the lymph system where it's processed and excreted. As we help to support those phase 1 and phase 2 enzymes, we're going to start to see some improvement as we clear the toxins at the cellular level. Another way we can do it is to facilitate elimination through the kidney's colon lymphatic system, by improving our hydration, making sure that as we're hydrated, things will flow better. Okay, our blood vessels are going to flow better, our lymph's going to flow better. As our lymph and blood flow better, we're able to get better nutrient delivery to the cells and also waste products and toxin removal from the cells, helping the cells to function better. Okay, and I love that these oils do offer a mild diuretic support, especially with the juniper and Revitazem oil, and cilantro with its chelating properties. It's going to help to pull those toxins out, and help us to eliminate them. Okay, another big thing that it's going to do to help at that cellular level, when you've got this dysregulation in the cell's pathway, you get a lot of antioxidant damage, or sorry, free radical damage. And so we need antioxidant support to protect against the free radical damage. And these essential oils are going to help to boost antioxidant support and glutathione inside the cell so that it can help to neutralize the free radicals and start to repair the damage, okay, which is awesome. So that's what taking the oils can do. But what we can do in addition to that, which is going to be just as important, is to reduce that toxin exposure. All right. And there's many ways we can do that. But as we're able to reduce the burden that our body has, it's going to give it a chance to kind of catch up and help us to eliminate them. And again, like that's what I love about doTERRA's approach to using Revitazen oil and Revitazen plus capsules over time. Okay, sometimes we're just going to need a little bit of support. Sometimes we might need a prolonged support, and Revitazen is designed to help either one of those aspects, really helping us to holistically detox at a cellular level. Okay. So then we got a question here. My relative had hepatitis in the 1960s. Her doctor still sees traces in blood work. What protocol would you suggest? I thought Revitazen. I thought of Revitazen. Okay, so again, like when we look at hepatitis, that is going to really affect the liver. It's very damaging to the liver, and that's probably why they're still seeing traces in the blood work, where the liver enzymes are being affected. Okay, oftentimes it can lead to scarring of the or like low level residual damage of the liver, and so supporting the liver and its ability to detox is going to be good, as well as supporting the liver's ability to regenerate. Now, I think all of you know how fascinated I am with the human body. It's one of the reasons why I became a physician. The liver is an amazing organ because it has the ability to really regenerate. Okay, it's like better than any other organ in the body. And so as we really give it the support that it needs with the tools that doTERRA has given us with Revitazen Plus and Revitazen capsules, it's going to support its ability to detoxify and regenerate. So, for this person, what I would recommend, like if they're still having issues, like I would probably be a little more aggressive. Okay, so I would definitely do one capsule a day, maybe two, for either maybe like 1 month, and then maybe go down to one capsule. But I would definitely take them daily for 3 months to support liver repair. All right, the milk thistle, the artichoke are going to be really, really helpful for that, especially as they support the detox pathways and provide the antioxidant protection. The Revitazen oil, which can be ingested just in a drop of water periodically, or massaging over the liver and maybe putting a castor oil pack over the liver, is also going to be really beneficial at helping to support the liver. Okay. And again, like I would do that daily or weekly for however long. Okay. To really just support the liver. And then again, kind of as we talked about, we want to make sure that she's also protecting her liver by reducing the toxins. So reduce alcohol, reduce chemical stresses, try to eat liver-friendly foods like cruciferous vegetables, lean proteins. They're going to be really, really good. And helping to support gut health with PB Assist or PB Restore is also going to be really, really beneficial. Another tool that can be really helpful in supporting the livers to regenerate would be the DDR Prime, to really offer strong cellular support for the liver, as well as VMG Plus and the Omega Plus. Okay. And I would be interested to see how that helps her over time. Okay, so some safety questions. How can I be sure the new products won't interfere with my blood thinners and respiratory condition? Also kind of use PP Assist instead of PP Restore since it seems to agree with me better. All right, so first things first, regarding blood thinners. Okay, and there's a lot out there. All right. None of the major ingredients with Revitazem Plus, the oil, Revitazem Plus capsules, Revitazem oil, and the castor oil, and one. I don't know if you're concerned about past tense as well, but none of them really show any um, interactions with thinning the blood, with the exception of past tense, in that it does contain some wintergreen and methyl, which has methyl salicylate in. Okay, it's a small amount, it's a small stick. I think if you were to have a problem, you would have to use multiple sticks all over the body, like at once, to really get a big enough absorption from a systemic application. Like we talked about this the other day, and I think it's like over 20, like maybe 25 sticks of past tense you'd have to like slather on the body to really get enough methyl salicylate absorption to have an impact. So you don't need to worry about that. Okay. Um, so when it comes to blood thinners, no, like these are going to be safe to use in addition to your blood thinners, which is really good. For respiratory issues, okay, now, I'm not, again, I haven't seen anything in the oils with Revitazem castor oil that would irritate the airway. Um, I would actually be interested to see how castor oil would actually help the lungs. Like if you were to put if someone's having some respiratory issues, I love putting Breathe on, like whether it's the Breathe essential oil or Breathe stick. I think castor oil on top of that would just amplify that. That would actually be really, really beneficial, especially because it's going to help to allow the oils to penetrate deeper, but also it's anti-inflammatory in and of itself. It's going to help to ease that discomfort and the inflammation, which is causing a bronchospasm. So I think that would be really, really good. And for past tense, like that has peppermint and eucalyptus in, which are really, really good at supporting the respiratory system. Eucalyptus, like there's actually a lot of research about eucalyptus and its ability to reduce steroids in steroid dependent asthmatics, as they use eucalyptus daily aromatically and topically to help settle down inflammatory issues in the lungs. So that, it really shouldn't be triggering respiratory issues. Okay. If you're really concerned, and this is like essential oil safety for anyone who's never used oils before, they're not sure how their body's going to react. Remember this adage, okay? You can always add more, all right, but you can't take away. So what I like to do, if I want to experiment with an essential oil, put a drop on, okay? If you're really, really nervous, I'd start on the sole of my foot because that's pretty tough. And then see how you respond to that. Okay. Oh my gosh, how many you remember when oh, it will come to me. Hang on. Shemazeline. Blue Tanzine came out. That was a fun essential oil because people would like we were told how good it is for the skin. So they'd get it out, put it on their hands, put it on their face, and like anyone who's done that, like you turn into a Smurf for the first little bit, right? You're covered in like the Shemazeline in Blue Tanzine is very, very blue. And so it's like, oh my gosh, what have I just done? Don't worry, it fades away very quickly, it gets absorbed and goes away. But that's the principle. Like if you put oils on and you haven't used them before, you might get a little surprise. Okay. So just use a drop and you can always add more. Okay. And then as you become accustomed to using essential oils and comfortable using essential oils and you kind of know what to expect, then you can just have fun with it. Okay. So start in a small area, and just know that you can always add more, which is nice. Um, oh, and then the PB, can you use PB assist versus PB restore? Yes, you absolutely can. Um, and what's really good is um, PB assist actually has different bacteria to PB restore. All right. It's designed to be easy for anyone to use. So, if you're not tolerating PB restore for whatever reason it is, maybe you've got a delicate system, maybe you just have trouble swallowing pills, the PB assist like little packet is absolutely going to be something which you can use instead of, or if you have no troubles and you want to take extra probiotics as well as, okay. Um, the main difference is PB Restore is going to have more strains of bacteria. It has postbiotics and bacteriophages, and it's going to really, we're looking at the supporting microbiome throughout the body, whereas PB Resist has fewer strains and it's really just focusing on gut health. Okay. Um, okay, my 3-year-old has several food allergies. We focus on gut health with PB Assist Plus. Would Revitazine oil, no pills, benefit her organs? Is she too young? How to use it? Yeah, you know what? That's a great question and a great example. A lot of times, um, oh, sorry, I just got caught on something. Okay, so a lot of times, um, allergies are common because of our organs of detoxification aren't able to process things appropriately, and our body recognizes them as allergens. Okay, so supporting them can help to reduce the severity of some of the symptoms. Okay, um, so how would I use Revitazine oil on a 3-year-old? I would massage it on the feet. Okay, I would massage it over the liver, and I love that idea of supporting the liver and detoxification pathways. I think that would actually be great. You could use because they're young. I think it would probably be best to use it diluted. So you could use it diluted with fractionated coconut oil, if you wanted to. Um, Trying to think what else we could do. Um, and yeah, you could do that every day, like every night, every couple of days. Kind of like depends how severe the symptoms are. Another thing which I think is really good when people have food issues is to use Terrazyme. And so again, like it comes in a capsule. So how's a 3-year-old going to swallow that? You can open it up and it's just a loose leaf powder. So if the 3-year-old, like, you can do it in a couple of ways. You could just pour it in with juice or water, mix it up, let her drink that. You could mix it in with some pudding or some yogurt. You could just do a fingertip, but Terrazyme is going to be helpful as well. So I'd be interested to see how Terrazyme and Revitazine would help. Okay. Um, Omega 3s would also probably be really beneficial. And so, again, oh my gosh, I love the new oh, right. No, tempting. No, here we go. The new Omega Pluses, because you can chew them, right? Um, and one thing which was surprising to me is it's fish oil, right? It's omega oil with wild orange, and it actually tastes really good. Okay, so if you've got a kid who you want to really help, you could do Revitazine oil, some Terrazyme, some omegas, and it's safe to open up those capsules and let them eat them. Um, I'd be interested to see how your 3-year-old likes the omega 3 actually. How many online right now have actually done that before where you've bitten into the omegas? Has anyone done that before? I'm just curious to know, am I the only one who thinks it tastes good, or are you guys also like it? Okay, good. I'm not the only one. Okay, excellent. I'm glad you guys are with me. All right. All right. So, safety for castor oil. How safe is castor oil? Can it be used by someone who had cancer, and how can we use it? So, it is. It is very safe, especially for external use. It's non-toxic. It's got a long history of topical application, and it's widely used in integrative medicine, even for cancer survivors and cancer support. Okay, because it's going to be good for pain relief, scar healing, and lymphatic support. Okay, if someone's getting radiation and getting a radiation burns, I think that could be really, really beneficial as well, especially as you combine it with like some of the calming oils like lavender, balance. I think that could really offer a lot of good support. There's no known risk that castor oil is going to reactivate cancer or interfere with remission. It doesn't contain any hormones or carcinogenic substances. So I think that that's going to be really, really helpful. Um, if they've got open sores, okay, I would probably encourage you to go around them, not necessarily right on top of them, depending on what is being applied to them. Definitely around them would be absolutely fine. Okay. Um, and then once the skin has healed to really, and you're dealing with scar tissue, that I think would be a perfect opportunity to use a castor pack. All right. So um you can either layer the oil cast on and put the pack on, or you can soak a cotton or flannel cloth in castor oil. It doesn't have to be dripping, just you know, kind of hold in plenty, and then put that over the area, the problematic area, whether it's an extremity, the torso, the abdomen, wherever. And then to kind of like really seal it in, you can wrap it up. Plastic wrap is a great way to kind of like hold it all in. And then if you put a heating pack on top of that for like 30 or 60 minutes, that's great. That's one thing I really, really do like about the wraps we got at convention this year. Um, you get the oil on, you put the wrap on, you Velcro it on, and did you notice it came with two different sizes of Velcro? Like you got the regular one and then a shorter one. So if you want to put it on an arm, it's super easy. Um, and I would leave it on for like anywhere from 30 to 60 minutes. Okay. So um, maybe you're a napper. If you like to take a good afternoon nap, this is a great time to like oil up, take a nap. When you're done, remove everything. You can gently wipe off the excess oil, or if you're going to bed, you can just let that absorb overnight and that will be fine. And again, like you could do that 3 to 4 times a week or daily if tolerated. Super easy. Um, so what is the best use on abdominal surgical scars? How to add castor oil into that? Okay, so I would say key elements when it comes to scar management is going to be hydration. You want to make sure that you're hydrated well and that the wound that you're trying to heal is well hydrated as well. Gentle massage. Okay, massage in the area actually helps to strengthen the scar as well, the tissue, and it also helps to remodel so the scar's less bulky, less likely to form a keloid. Okay, so that's going to help with the gentle massage is going to help with soft tissue remodeling. And then you want to avoid excessive tension on that scar, right? So if a scar's healing under stress, it's just not going to heal as good um, as if the tissues around it are relaxed. Okay, so a lot of times if I've got someone who's cut their elbow or their knee or like a finger, I don't want them bending. Okay, because that's going to place extra tension on it. Same thing with the abdominal incision. If anyone's ever had an abdominal incision, it's really advisable to kind of sleep in a propped up position. So you got a little flex between your legs and your abdomen, as opposed to laying flat on the bed, which is going to put more tension on it. Okay. So how do we then use castor oil and oils? Oils that I like to use for scar management are going to be things like copaiba, and helichrysum. Those are probably my favorite two essential oils, and I would put those over the oil and blue tansine because it's going to be really penetrating. So you can put whichever oil that you like to use for scar management. For me, I would pick copaiba and helichrysum. Um, Obviously frankincense and rose. They're really good as well. On top of that, I would then put some castor oil. Now, depending on where the scar is, I would probably so let's say if it's on the abdomen, um, I'm doing low down because like a lot of the abdominal incisions that I think about would be for like appendicitis, C-sections, hernia repairs, so you can massage the area, like put your oils on, put the castor oil on. You can massage the area, put a pack on top, and then put a heat pack on. Okay, and that's going to be really, really helpful at managing abdominal surgical scars. And again, like every day. Okay, do it daily. Another great thing you can do is also take the MetaPower Advantage with the collagen that it has in it. Is going to be really good at helping to for tissue healing as well. Um, oh, this is a good one because here we go. Ready? With changing seasons, when you feel you're starting to get sick, what is best to do? Okay. And I love that question. And this is one of my reasons why I love doTERRA. I remember going through medical school, I had Noah, my firstborn son, had a lot of asthma. And um I remember, like, as I got close to graduating medical school and being able to prescribe medication, like, feeling like, imagine the freedom. Imagine that moment where my son is having an asthma problem and I don't have to take him to the doctor anymore. Like, I can be the doctor and I can call in antibiotics or a steroid for him, right? Imagine how that's going to be, right? And little did I know that just a couple years after graduating, we would actually be introduced to doTERRA. And how much more effective and powerful is it? The very moment when he starts to feel like he's getting wheezy, he can just go grab some breathe and put it on his chest or just breathe, like inhale the bottle, right? Um, how empowering is it for me as a parent to be able to like see my son struggling to breathe and be like, hey, did you try this? Like, let's sit down and let's get it on you and just kind of like massage it on his back, massage it on his chest, put it on his feet, and really help him like in the moment that he needs it. I remember when he started playing soccer, we used to use his inhaler, and we ended up just using Breathe, where Ruth and I would be either side of the field, so as he would run around, he could just grab it from us. Um, and like what I thought would be freedom by being able to describe the medication, like I didn't even have to need I didn't have to use that anymore because I had true freedom where not only could I have something at home to use right away, but a lot of times Noah was old enough where he would just get it himself. And we joke about this. He moved down when he left on his mission 2 years ago, and we were cleaning out his house. I lose track of how many deep blue bottles we found and bottles of Breathe. But like, I love that with these tools, we're able to have an impact right away, right? And not only we as parents, but our children can use them safely as well. Like that's true empowerment to me. All right. So when seasons start changing, when you start feeling sick, that's when you grab your essential oil. Okay. Um, which oil do I like to use? I like to use On Guard. On Guard is my absolute favorite essential oil. It will be the one I recommend to anyone who's starting to feel like they're getting sick. Grab some On Guard. And I don't care how you use it. Okay, so let's just review like what options do we have when it comes to On Guard? So we've got the oil. I like the oil because I can diffuse it. I can take it, I can apply it topically. So if my throat's getting scratchy, I can actually put it on my throat. I like that I can put it in some water and drink it, or a capsule and take it. A lot of times, when I start to get sick, I feel it in my throat. Like you most of the time it's going to be an upper respiratory issue. So I like to make what I call immunity. All right. Some of you might have already heard about that. So I grew up when we got sick, my mom would make us a tea, which was just hot water, some honey, some lemon. Okay. How much honey, how much lemon, really however much you want. Usually I do like, you know, a tablespoon, at least a tablespoon of honey, a squeeze of lemon, and that was my get better tea. With doTERRA, started adding a drop or two of On Guard. Again, remember, you can always add more, but you can't take it back. So if you've never done it before, just try, you know, get like 1 or 2 spoonfuls of honey, pour in some hot water to let it melt, mix it up, put in some lemon juice, like a teaspoon or however much you want, and you can adjust it to your taste preference. Okay, no harm in that. And then add a drop of On Guard, right? Try that. If you're like, yep, that's all I need, that's great. If you want it stronger, add another drop. You want it stronger, add another drop. Okay, you get to choose how strong you want to make it. But I like then being able to sip on that. And that just, you've got the therapeutic benefit of honey, the vitamin C in the lemon, and you've got the immuno support from doTERRA's On Guard blend, which is going to be really, really helpful at supporting the airway. Okay. So the oil you can use aromatically, topically, internally. You can use the little beadlets. Okay. Those are the tiny ones. And what I like about them, you can swallow them or you can pop them in your mouth. Okay. I'm curious to know, those of you who use the beadlets, how many of you like to pop them in your mouth versus swallowing them? Um, I like popping peppermint beadlets in my mouth because I like how fresh it feels. Um, if I'm just feeling a little sick, usually I just swallow the On Guard beadlets. But if I'm feeling it kind of like in the back of my throat, I like getting oils where it's the problem. So I like to pop them in my mouth and then swallow them. Okay, yep, looks like a couple of you guys like to pop them as well. Okay. Um, you can do one, you can do two, you can do three, like it's up to you. All right. But what I like is, you can take them. Then you've also got the soft gels. Okay. The difference between the soft gels and the beadlets, they're bigger. So usually it's about 3 drops in a soft gel. It's also got oh boy, am I going to remember this now? Black pepper, and I want to say Melissa. Sorry guys, it's been a while. Um, but I like it because it is going to be a little stronger, a little more potent than just using the On Guard oil or the On Guard beadlets. And so my habit when I'm working in emergency department, especially during the winter, is I usually take one in the morning, okay, before I go into work, just to kind of like be proactive. If I know I'm going to go into an environment where I have a high likelihood of coming into contact with someone who's sick, I like to be proactive, so I'll take an On Guard Plus. If I'm traveling, I'll take an On Guard Plus, or I'll take beadlets kind of, if we're doing multi plane trip, like with each plane ride, usually I'll pop a beadlet as well. So that can be really, really good. And again, like if you're starting to get sick, I like to kind of get on top of it quickly, right? So I will um start my immunity, take a soft On Guard soft gel, and I might take it in the morning, in the afternoon, in the evening. Okay, just to kind of really kickstart my body. All right. We've also got the um, what is it called? The On Guard capsule, which also has some zinc, which is also in immunosupportive. Oh, look at that. We've got them right here, actually. Um, and so I like this. This is another way you can support your body. Um, zinc is a great way of helping to support your body against viruses as well. So that can be great. And again, you can chew 'em as needed. You've got the On Guard toothpaste, which is great because again, you're protecting your oral cavity, which is the main entry point for a lot of the sickness going around. You've got the On Guard mouthwash, which you can do as well. And what I like about the mouthwash, not only are you kind of getting the gums healthy, but you can like gargle it. So I like getting a good swig, gargle it, and just seeing how far back in my throat I can get it. Yep, Kim's right. You've got the On Guard lozenges as well. And again, what's cool about that is, yeah, you're getting the oil right all the way down the oral pharynx, um, to really like help it where it's at. Okay. I think I saw something here again. My friend weaned off her inhaler by using breathe instead. And that's another great thing which I love. So how could you use, oh, maybe we should do this. Do I have, I don't see breathe right next to me. Hang on. No, I got wild orange though. So let's do this because this is same thing. So if you're having some respiratory issues, okay, pat like your friend, this is a great way to use breathe or an essential oil. Okay, so let's say we got our drop of oil. I'm just using orange because that's what I've got, and I love it. So a lot of times, maybe we're feeling it in our sinuses. We're feeling really nasally, just just feeling miserable. If we want to help open those ways, an easy way to do it: put a drop of breathe on the hand, make a fist, so we're like this, and then put your nose in that, so you kind of got a little hole, and then just breathe through your nose. Boy, and I tell you what, it's like taking a hit. Okay. Um, do that a couple times. Like try it. Next time you guys are feeling like congested, get some breathe. And let's be honest, it could be any menthol oil. So whether it's breathe, digestin, supermint, peppermint, that's a great way to kind of get it into the sinuses and help open it up. Or maybe it's more in the chest. Okay, if it's more in the chest, then I like to put my mouth over that same orifice, like the hole that you make in, and then just suck in through the mouth. So in this case, and then hold it in. And what I like about that is you really feel it, oh, going down. Oh, that's actually pretty nice. I've never done that with wild orange before. Good taste in my mouth. All right. But what I like about that is same oil, but having two very different effects. Okay. So depending on where you're feeling sick, definitely get some On Guard going. And then if it's kind of respiratory thing, like in addition to the On Guard, I love using breathe. I also like using Airex. Okay. And maybe that's another good question which I'd like to know for you guys. When you're how many of you like breathe? How many of you prefer Airex? Okay. Do you guys have a difference? Um, okay, so breathe, breathe. Oh, a lot of people are loving breathe. Okay. So, and it's funny because I had a chat with this last time I was actually at doTERRA. Oh, Lilith, I love it. Eucalyptus. Um, why would you use Airex over breathe? That is a really good question. Okay, a lot of people don't use Airex because they're just not as familiar with breathe. So Airex is unique in that you can use it aromatically, topically, but you can also use it internally. And it looks like someone, yeah, Ashley likes Airex internally. Um, and so that's nice because again, it can be really supportive to the oral pharynx as it goes down. Another great way in which you can use oils to help support the respiratory system is if you boil some water. So if you get a kettle or a pot of water, boil it so it's kind of producing steam, and then put a drop of your essential oil to support your respiratory system. So whether it's breathe with eucalyptus, Airex, Supermint, put a drop in. And again, you can always add more. So just start off with a drop if this is the first time. Get a towel over your head and just ten over that pot or over that kettle of steam, and then just kind of breathe it in. And again, try breathing through the nose, try breathing through the mouth, and see how that helps. But the steam is going to help to open things up and kind of break things up, and then the oil is also going to help open it up as well. Um, trust me when I say you can always add more. Um, if you go put in 5 drops in and put your head over, sometimes that's a little too potent. You might start tearing up. So just start with one drop. You can always add more as needed. And steam inhalation can be really, really beneficial. Another thing which would be great, which we can now do now we have castor oil. Let's say you've got a scratchy throat, put On Guard on, and then layer with castor oil. Let's say you've got respiratory issues, put on Breathe, RX, eucalyptus, layer with castor oil again. Okay. Um, I would say like when people ask me what oil should they have and what oils do I travel with, On Guard and Breathe are like always with me. I also like things like Serenity, Copaiba, frankincense, helichrysum, Digest-Sen. Oh, definitely Digest-Sen. Um, Shinrin-yoku, I like that. But I like to travel and have accessible my essential oils, so that when something happens, I've got tools that I can use. And so like as you're getting ready for the winter season to kick in, I would highly recommend taking advantage of when doTERRA um, gives us the opportunities to really maximize our dollars and give us the free products of the month, like um, On Guard, Breathe, Digest, and like to really just get as many as you can, because it's going to be something which is going to come in handy time and time and time again, and something which is really good to share. All right, guys, I got carried away. I just saw it's 8:40. Thank you for hanging in with me. Um, I hope it was helpful. And don't forget, we're going to be doing a kickstart for our 90-day challenge on Thursday, October 23rd at 8 p.m. Central Time. Okay. You guys have a great day. It's been a pleasure.